So we're going to be doing the neuromuscular system next. And I think that you'll find that neuro can be a little overwhelming. The cheat sheet that we have posted for you is actually really helpful. It breaks it down into step by step by step. Half of this stuff you have already been exposed to in some way, shape, or form. You've already done Romberg. You've already done the Snellen. You've already done confrontation. So we will go through them all again so that you see the order, you see how it goes. But again, you've been exposed already. Not to Corona, but to this material, okay? So just enjoy it, relax, try to follow along. We have our cheat sheet out so that number one, we don't miss anything, because I never miss anything. And number two, because then you can follow along. We want to make sure we're going in the right order. And if you're in my lab, you know that I have my own personal order in my head. And so I'm really trying to follow along with your cheat sheet.
Right. I think this is a great example of, here's all your cranial nerves for you. I'm not necessarily into their popular mnemonic, OOO, to touch and feel a girl's vagina, heaven. Sorry. But I
never even noticed that.
Hello. I am a little more like on old Olympus towering top. A Finn and German viewed some hops. That's the old way of doing it. That's old school. So
yeah.
You do need to know your cranial nerves. So however, I guess if this is how you need to get them in it, that's great. There's also a mnemonic to let you know whether they're motor or sensory or both as well. And that has boobs in it. So maybe you can look that up online for yourself.
I've also posted 2 additional cheat sheets for you. That one is a face and then one is actually the brain, and it goes through everything that you need to know. So I think if you want to, they're not on the actual cheat sheet that we have for you, but if you want to utilize that, you completely can. I apologize for the vagina comment. I will be fixing that for next semester. Anyway.
I was like, oh.
I didn't see that. Huh. Anyway, so off we go, okay? I've already said hello to my patient. You all know Professor Ross by now. I'm Wendy Gilchrist, Professor Gilchrist, whatever you want to call me at this moment. And I have already done alert and oriented ×4. President Trump is still president, and we are doing cap refill less than 3 seconds because I always start with cap refill. Mwah! I'm passing my germs on, okay? So I will be, I always give. Yeah.
Important.
I'm so sorry. Let me go ahead and I bribed her with muffins. I'm going to go ahead and do olfactory. So the first thing that we want to do is cranial nerve number 1, which is olfactory. And by doing so, that is actually what causes smell. So fun fact about smell. Do you know that if you can't smell something, that you can't actually taste it? Because smell and taste work together. And so I always encourage that if somebody can't smell something, or if they have a facial injury and trauma, realize that their food is also not tasting as good to them, because smell plays a role in how food reacts. Please excuse, that's my husband calling. There we go. All right. So I'm going to have you go ahead and close your eyes for me, please. It is. It's Snoopy. Welcome to our day. So please go ahead and close your eyes for me. And I'm just going to have you smell what I put under your nose. Traditionally, cinnamon stick, oranges, those are the best ones. Big whiff.
Orange.
Great. Some vitamin C for your head. So cranial nerve number 1, which is, again, olfactory, is intact. We're now going to do cranial nerve number 2, which is visual acuity.
Or optic nerve.
Optic nerve. So we're going to do the Snellen again. So if you can please follow me, let's go do the Snellen.
Okay.
And I'm going to have you go stand approximately 20 feet. I'm going to have you read line 7. If you can please cup over your eye, read line 7 for me.
FELOPZD.
Great. If you can please read line 8.
DEFPOTEC.
Great. She's approximately 2015.
We've been there.
But we've been there.
The other side.
So she's going to do the other side, line 9 backwards, please.
TCPDOF. EL or something like that.
Awesome, like you are 2015. Great. While we're standing here, we're also going to do confrontation again. Remember, confrontation is when we're going to fight each other. We're going to be, again, very subjective with looking at peripheral vision. So we're going to stand approximately 18 inches apart, and I'm going to cover that. We're going to cover the same eye across from each other. So she's covering her left, so I'm going to cover my right. And again, we're 18 inches apart. Please focus in on my nose. And I could see those fingers, and let me know when you see these. I could.
What about this?
Yeah,
Let's
awesome.
do this.
Let's do the other
Do
side.
you see it?
Okay, I do.
What about here?
Yes.
What about here?
I see your wrist. There you go. Awesome.
All right.
So there's confrontation. There you go. So cranial nerve 2 is intact, which is also known as the optic nerve. There you go. Optic. So now we're going to test cranial nerves 3, 4, and 6, which are ocular, motor, trochlear, and abducens. Yes, you do need to know these cranial nerves. You will be asked, if you do not tell us what they are, you'll be asked to give them to me, okay, or your clinical instructor. Okay, so I'm going to check for Perla. We want to make sure that your eyes are reactive equally. So again, handy dandy pen light, which I lost again. There it is. Handy dandy pen light. So I'm just going to check. I'm going to have you focus in on my nose, please. And I'm just going to double check that your eyes are reactive and accommodating to light. I'm going to look for corneal light response and reflex. And that is all we need to do. Okay. Now I'm going to do, we did confrontation, cardinal gazes. So the EOMs, again, 3, 4, and 6. If you can please focus in on my finger.
And you got a good picture of that in your cheat sheets there too,
yes,
of the gazes. Okay.
Okay. Make sure you look at that. Okay. If you can focus in on my finger, please. And I'm going to have you follow without moving your head. Again, remember, you do not need to go really fast. You need to just be very consistent with your patient. You have 15 minutes to complete this assessment. When you do this, we're hoping that we will all be together for this final confrontation exam, or what are they called? Competencies? Yes.
Competency.
And then I'm also checking for accommodation. What is that? I'm going to now use my finger and have it fall in, and her eyes are able to follow exactly the same, and so accommodation is intact. So that is no nystagmus, no lid lag. Patient cranial nerve number 3, 4, and 6 are fully intact. We are now going to do cranial nerve number 6, which or 11, I'm so sorry, is spinal accessory. And that is observing the sternomastoid and trapezius muscle and the neck muscles. You have done this back in neck, so don't forget, okay? So I'm going to have you tilt your head to this way and tilt your head this way. Can you please tilt your head forward, tilt your head back? Can you please stare at the camera and stare the other way? And can you please shrug your shoulders? Great, go and relax. I'm going to have you do that with resistance, okay? If you can please push against my hand, push against my hand, push against my hand, push against my hand, and push against my hand.
She's manhandling me a little bit.
She's falling over and she can't get up. Go ahead and lift up. Awesome. There, she's shrugging her shoulders, okay? So cranial nerve number 11, which is spinal accessory, is intact. Now we're going to do hypoglossal. We were wrong in the last video. Hypoglossal is 12. Oh my goodness.
I know, after you said that.
We are so sorry. Forgive us.
10 is the
You
vagus
all
nerve.
were going to have sent us multiple emails, and we already know that we are wrong.
It wasn't the vagus nerve.
I know. So you're going to just stick out your tongue at me, and then say light, tight, dynamite.
Light, tight, dynamite.
Woohoo! So cranial nerve number 12, hypoglossal, is intact. Now we're going to do cranial nerve number 5, which is trigeminal. We're going to look at the temporal and masseter muscles and have the patient clench her jaw. So go ahead and clench her jaw for me. And I'm going to put my thumbs on her chin, try to open her jaw. Her jaw is unable to open, so cranial nerve number 5, trigeminal, is intact. You're also going to have her close her eyes. This is still with cranial nerve number 5. And see the cotton Q-tip. Again, you can use a piece of cotton at home. Every time you feel me touch your face, I'm going to have you say the word now. After you grab your glasses.
Now. Now. Now.
And you're done. Save this for later. Put it back into the container so you have it for later. Great job, everyone. Cranial nerve number 5 is intact, which is trigeminal. Cranial nerve number 7, which is facial, is next. You're going to have her facial symmetry. You're going to observe that her face is symmetrical. Her skin is fully intact, and she's been able to respond to you symmetrically when she talks. Can you please smile? Can you please frown? Can you please close your eyes tightly? Can you please open your eyes and lift your eyebrows up? Can you show me your teeth? And can you puff your cheeks? Great. Okay. So facial nerve number 7, cranial nerve 7 is now intact. So acoustic, we're going to be doing, patients been able to, which is cranial nerve number 8, by the way. Your book says acoustic. Please do not say auditory. Jarvis goes by acoustic. I've double checked that. 8th edition goes by acoustic, not auditory. That is a different textbook. But one of the things that she's been able to hold a conversation with me, so her cranial nerve number 8 is intact. We're also going to do the whisper technique. We're going to follow what your textbook does, and you can also do the little hair thing. But I'm going to come behind and do the whisper test again. Can you please cover your eye? Can you please cover your ear for me? Cup it over it. Great. I'm going to whisper behind you approximately 18 inches.
1, 2, 3.
Great. And can you please switch ears? Don't forget to cover the eye.
1, 2, 3.
Great. Cranial nerve number 8, which is acoustic, is intact. Goodness gracious. We are a little jumpy. We've had a lot of coffee. So cranial nerve number 9 and 10, which is glossopharyngeal and vagus, we're going to have the patient say ah. You may want to have your pen light available and a tongue depressor because you want to look at the uvula and watch it wiggle in the back, and the tonsillar pillar is also moving. So with that, give me 1 second. Let me open this up. Let me turn my handy dandy pen light back on. I know, gag reflex. Blah, blah. Notice I'm not going to get her with her gag.
Sorry.
I touched the tip of your tongue.
I am quite a efficient gagger.
So goodness gracious. Okay, cranial nerve number 9 and 10, and 10, glossopharyngeal and
Vagus nerve.
Vagus, not hypoglossal.
Or
Vegas is intact.
Viva Las Vegas.
Viva Las Vegas. I wouldn't go there
Viva
today.
Las Vegas.
I would not go there.
No.
Okay, so now we're in the muscular system. Okay, you've done your cranial nerves. Good job. Clap. Applaud yourself. Great. So now we're going to do the muscles. Muscles are super simple and chill, okay? I'm just going to bilaterally examine the muscles, make sure that they're approximately equal bilaterally. I'm not going anywhere near her toes. Remember my rule, if you touch your toes, you can't touch the face without hygiene. And then I'm going to have her squeeze my fingers with her hands, and they're equal bilaterally. Please feel free to squeeze all you want. Go ahead and relax. So her muscle coordination is intact, relating to they're equal bilaterally approximately. This is not a measuring tape situation. This is making sure that her muscles, one side is not significantly larger than the other. When you're having a patient squeeze your hand, you want to use 2 fingers. The reason is that they cannot break these 2 fingers when they squeeze them together. If you do 3 and they squeeze them, they can actually break your fingers, your entire hand, or 1 finger, they will snap it off. It's a labor and delivery trick. 2 fingers, okay?